Good afternoon. Thank you, Lion Rushma. As Lion Rushma has just mentioned, today is World Diabetes Day. Every 14th of November each year is that, and each year they have a different theme. And the theme this year is Nurses Make the Difference. So as a way to show our appreciation towards the nurses at HSA, the Lions Club of Grand Cayman has decided to give them a certificate of appreciation for their contributions in the prevention and management of diabetes. Now, we have, I think it was a total of 18 nurses. Unfortunately, only one is present here today, and the rest were not able to make it, but we will make that presentation to those other ones at a later date. So what I'll do now is just ask the one nurse that is here to come up and to receive her certificate of appreciation, and once that has taken place, I will then just call out the names of the other nurses that we're honoring for their work in diabetes. So with that said, I would invite Ms. Nurse Cynthia Powell to come forward and to receive her certificate of appreciation for her contributions in prevention and management of diabetes. Thank you so much. Wrong hand. This way. Sorry.
But it is about choosing the right type of carbohydrate. So when you're choosing the right type of carbohydrate, you have to think of the fact that all carbohydrate affects your blood sugar. And it is important to know which food contains carbohydrates. So choose the healthy foods that contain carbs and be aware of your portion sizes. So these are some tips that you need to look at when you're choosing a healthy source of carbohydrate. Choose things like whole grains, brown rice, buckwheat, whole wheat oats. You can look at things like amaranth, teff. You can look at quinoa. So don't just focus on the mere fact that you need to have, white rice, or it has to be cassava, or it has to be bananas. Yes, those are important, but make sure when you're having these things, you look at the portion sizes. So it is very important on looking how much of these things we're having when we're looking at our plates, and look at the types of carbohydrate that you're choosing. Now, when you're choosing your fruits, you have to be mindful of the types of fruit that you choose, because yes, all fruits have sugars, but some fruits are sweeter than others. Then you look at your vegetables. We have starchy vegetables and we have non-starchy vegetables. We always try to emphasize on focusing on non-starchy vegetables. You can have your starchy vegetables, but you still have to be aware that these starchy vegetables have more starches, or will break down to sugar, give you more sugar, more carbohydrates than the non-starchy vegetables. right? Look at things like pulses, like chickpeas and beans and lentils, which are higher in fiber, because fiber is very important, especially if you're trying to lose weight. You need lots of fiber. And also remember, fiber does not go well without water. You need lots of water, because you have a lot of people who say, yes, I'm taking a lot of fiber, but the reason I have cut back on my fiber intake is because I'm having constipation problems. It's because you are not having enough fluids with your fiber. So fiber is important in losing weight, but you need to make sure that whatever fiber you're consuming, you need to double up on the water that you consume in order to get the benefits of your fiber foods. Look at your dairy as well, because dairy foods do contain sugars. So your milk has sugars, and the byproducts of dairy foods, like your yogurts, that was a tongue twister, your yogurts, things like chocolate, if it's milk chocolate, all of your byproducts of dairy food most often contain some sort of sugar once it has milk. If it's a milk substitute, you want to make sure that your milk substitute, if it's plant-based, that it is unsweetened or sugar-free. So you have to look at those things, because oftentimes patients will ask, why are you talking about milk? Does milk contain sugar? Milk contains sugar because the milk comes from the cow, and the cow does need some sort of glucose or energy to grow, and that's where they get their sugars from, the milk. And so they grow very fast. So you have to understand that your milk does contain sugar, and you have to be aware of the amount that you use. Now, eat less salt. Salt is important in somewhat to your diet, but remember, you get salt from natural sources from your foods as well. So you have to be careful of the added salts that you put in your food. So eating lots of salt can increase the risk of high blood pressure, which is in turn increases your risk of heart disease and stroke. And people who are diabetic oftentimes end up with some sort of heart disease, or may in turn have high blood pressure, and at some point have stroke, or they will know of people who have had these conditions and have stroke as well. Also, the third thing you want to look at, you need to eat less red and processed meats. The fact is, people are always asking about red meat. But in 2015, we have to remember that the World Health Organization has finally agreed with dietitians that the way how red meats are reared on their farms, they are provided with lots of antibiotics, and this is for immunity. They have to create herd immunity, and so most of these meats have become carcinogenic based on how they are treated. So you have to be mindful of how much of these, and most of the red meats that they have gone through some sort of processing. So you have to look at those things as well, because these things will affect your weight over time as well. Processed meats such as ham, bacon, sausages, beef or lamb, these have all linked with heart disease and cancers. So you have to look at those things. And remember, once you're diabetic, that's already one disease. So now you're at risk for other complications, and those other complications will put you at risk for having additional non-communicable diseases. The number 4 thing that you want to look at is eat more fruits and vegetables. People will ask, why more fruits and vegetables? The fact is that when you look on your plate, there are such wide variety of carbohydrates or bread kind. We never have to think about what bread kind we're going to have on a daily basis, because there's always going to be some sort of bread kind on your plate. There is always going to be some sort of protein, because most people, they don't live to eat, but they eat to live. So basically, they will eat some sort of protein on a daily basis, whatever type of meat they choose. They will eat some sort of carbohydrate, whichever one from the right variation, whether it be processed carbohydrates or natural carbohydrates. They will choose one of those. But you don't find that on a daily basis there is a representation of fruits or vegetables on your plate. So if you see that on a daily basis there is no representation of fruit or vegetable on your plate, it simply means you're not doing well. And you have to remember this. This is one thing you need to remember, that your fruits and vegetables, these are what contains all the micronutrients the small ones that we don't think of, like magnesium. I realized with COVID-19, it was so funny when everyone was running around the pharmacies looking for zinc because they heard that zinc helped with, increasing or boosting your immunity, not realizing that we can get zinc from most of our vegetables and fruits as well. So you need to look at where you can get zinc from in your daily routine as your fruits or your vegetables that you can get these micronutrients from. The fact is that when you're lacking in these micronutrients, you don't realize it until when your doctor orders a complete blood panel and they will say, oh, these things are what are low in your system and that is why you are sick. So oftentimes when your immune system needs some sort of boosting, is because you are lacking in certain micronutrients. So look for your fruits and your vegetables. So if it is that you want to manage your diabetes well, look to your fruits, and I'm talking about the low sugar fruits, because what I've been asked over the decade that I've been doing this is, can I juice my fruits? The fact is that I was explaining, and I've been explaining this to patients, when you juice your fruits, you will need at least 4 or 5 oranges just to get at least 10 ounces of juice. But if you decide to eat an orange, you're not going to sit and peel 10 oranges to eat them. So you will eat 1 orange. But when you buy a bottle of orange juice, sometimes a gallon bottle of orange juice have maybe around 15 or 20 oranges inside that gallon bottle. And you are getting more sugar, and that juice is going to go straight to your blood. It's liquid. Liquid mix well with liquid. It's not oil. So once you take in those juices, it's going to go straight to your blood, and that's where your blood sugar will go up. Now you have to choose healthier fats. Look at the types of fats that you're choosing. Healthier fats in foods like unsalted nuts, seeds, avocados, oily fish, olive oil, rapeseed oil, sunflower oil. Some saturated fats can increase the amount of cholesterol in your blood. And what we find is that people who are diabetic sometimes, most often, have cholesterol problems too. So look at the types of fat that you're eating. The sixth thing, cut back on your sugars. And remember, we just talked about sugars. And there are various ways that you can cut back on your sugars. Look at the juices that you're consuming. Look at the packaged foods that you're consuming. Always read your labels. This is very important. And that's one of the main reasons why it was my point of duty to get a label. So everywhere I go to do any form of presentation or to put up a booth, I always bring a label with me because people do not pay attention to their labels when they're purchasing food. Remember, that is not just about looking at the front and understanding what the food is that you're going to eat. If people will see, okay, it's a banana drink. But once they understand that that is banana, everything else on the back, even if it's Spanish, even if it's French or German, they are not worried about that. They only know that on the front it says banana, and they're so certain that it is banana. But you have to look at what else is in your food that you're consuming. Be smart about your snacks as well. That is the seventh thing that you need to look at. Remember, a snack is not a chip, it's not a cheese cracker or something. A snack is a smaller version of a meal. So anything can be a snack. So you can make a small sandwich for a snack. So it's not always about popping a chip or something like that. So make sure that you're making healthy choices when it comes to your snack. If you're using yogurt as a snack, make sure that you check whether it is low in sugar or low in fats, because oftentimes we will look for the sugar but we don't look for fats. We will look for fats but we don't look for sugar. But look for both. Unsalted nuts, seeds, fruits, and vegetables can make very good snacks. The eighth thing, if you drink alcohol, be sensible about your drinking. Because remember, alcohol doesn't really readily mix with blood. It goes straight to your liver because alcohol is very volatile. And that's why you have so many people not just have diabetes, but they have, alcohol fatty liver disease as well, because they consume so much alcohol and don't realize that alcohol is very volatile. So it can go straight through your cells rather than just mix in your blood alone. The eighth thing, don't bother with so-called diabetic foods, because oftentimes you will hear people talk about what diabetic food I need to have. It's not about having diabetic food. It's about eating healthy. Most often that you find companies making things that they call diabetic meal, or this frozen diabetic meal, or this frozen diabetic drink. It's high in preservative. Why do you think it stays so long on the shelves? You have to be very careful about these packaged things that they're saying are diabetic foods. There is no better diet than a holistic, healthy diet. Comes straight from your backyard. You're the same cassava that we have, the same green banana, the same breadfruit, the Caribbean foods, the Caribbean sweet potatoes. These are good and healthy. And if we focus on these foods and we minimize our portions, then we will be able to put a stem in this diabetic thing. But we're looking far and wide for all the imported things, but we're not looking right here at home of what we have in our backyards. The 10th thing, get your minerals and vitamins from your foods. I cannot emphasize that more. Get your minerals and vitamins from your food. You don't always have to pop a pill. It is important to understand that, right? A pill is not always a necessity. Some things like chocha, which is a Caribbean food, a lot of people don't know chocha, but it's high in vitamin B, right? And it does have vitamin C. So if it is that you're looking for certain nutrients and you believe that you need to buy vitamin B12 and so on at the pharmacy, you can check your foods and you would realize that most of these vitamins are accounted for in your foods. And don't forget to always keep moving. It is important to keep moving. If you sit down for too long, it's not that you will all gain weight. That's not the most important part. But what about having things like clots in your legs, right? So those things will happen as well. So you have to keep moving. Take 15 minutes or 10 minutes from your work time if you're somebody that works at a desk, and keep moving. It is important to keep good blood circulation and keep your heart rate going so that your heart does not get lazy. Some of us, we have very lazy hearts, and because our hearts are lazy, we become very lazy and stagnant. We sit down all the time because we don't realize that our heart is just a representation of how we have been feeling all along. We sit down so long that our heart becomes lazy. Thank you very much.
Tamara, thank you very much, Tamara. Before you go, I just have a curious question about nutrition. Now, how do you decide your meal if you're going out at a restaurant and you want to make sure that you're within your diabetes diet and staying healthy? How do you decide on options like that?
If you are eating out, nothing is wrong with eating out. But before you leave your house, think about where you're going to eat. So if you think about the restaurant that you're going to eat, you will automatically know the types of food they prepare at those restaurants. If you are not sure of what those restaurants prepare, find a number in your phone book, call them up, ask them, do you provide things like bulgur? Do you provide brown rice? Do you provide, quinoa? Just find out what they provide at the restaurant and see how best this works for your diabetes. Oftentimes we will go out and we spontaneously stop at a restaurant and they don't have what will benefit us. So it would be important for you just to make a head start by calling them and see what they prepare. And then you look at your portion size. Order smaller. If you have to eat later, do more vegetables and do a protein. Be minimal on the starches because that's a time when your blood sugar will go up because you are sitting down more. When you leave the restaurant in the evening, oftentimes you go home, you may take a shower and you go to bed. So it would be best to be minimal on drinking juices. Take water instead. It would be best to minimize on whether or not you're going to consume alcohol at that hour of the night. Keep those things earlier in the day if you have to, so make it an early brunch. If you have to eat later, stick more to water. If you have to do a juice, stick to something like flavored, like not flavored with sugar, but just naturally flavored, fruit-infused water, and have more vegetables, a protein, and be very minimal on your carbohydrates.
Thank you, Tamara. I really appreciate that. Can we give Tamara a round of applause for her presentation? Thank you very much. That was very informative. It's always important to maintain a healthy diet. Even if you don't have diabetes, it always works in your favor. For those of you who are joining us live on Facebook and YouTube, you do still have time to come down and get your free A1C testing, PSA testing, site testing, and free diabetes and nutrition consulting. I'm very excited to introduce our next presentation, Ms. Jamelia Budu, who will be talking about foot care. Now, foot care is important. We're not talking about the pedicure and pretty toes, but we're talking about keeping healthy feet. So, can we welcome Ms. Budu to the stage?
Good afternoon, everyone. I am Jamelia Budu. I'm a diabetes resource clinician and a pharmacist for over 10 years. And I'll be speaking to you on diabetic foot care. Sorry. Just a plug, if you know anyone who is deaf or who is hearing impaired and could benefit from this speech, I can translate for them at another time. You can talk to me after the presentation. So we're looking at the feet, these two little things that carry us around. Essentially, the foot or the feet is just a bunch of nerves, muscles, and skin, but they're very important. This is proven by if someone tickles your foot bottom, or if you buck your toe or stump your toe, or if you sit for too long, your leg goes numb and you don't feel a thing. The nerves essentially tells the muscles what to do, and the skin facilitates as a protector of the feet. Now, what does diabetes have to do with the feet? Essentially, if your blood is too sweet, you'll see it in your feet. You won't feel it, but you will see it in your feet. And this is as a result of the breakdown of the nerves and the vasculature or the blood vessels in the feet. If you consider your nerves as a communication roadmap from your brain to the rest of your body, messages are sent along the nerves right throughout your body. Now, if something comes and blocks that, such as diabetes, then there is no message to pass on to the feet. And if your body isn't getting any messages from the nerves, then it's going to think that nothing is there, nothing is happening. So it's not doing anything. And if you lose it, if you don't use it, you lose it. And that's where diabetes comes in when we talk about foot care. Now, what are the signs and symptoms of having diabetic feet? You essentially will lose sensation. There's no messages traveling to the feet, so you will not be able to feel hot or cold. Extreme temperatures of heat and cold and also pain will not be easily noticed. You will also have slower wound healing. If you have a cut or a bruise on the feet, you will not feel it, and then it will cause, no attention will be brought to it because your body won't be able to realize that you have a cut. And then because of the decreased vasculature or the blood vessels being damaged as well, there's no blood flow, and so it's more difficult for that wound to be healed. Another sign is that you have dry feet. Your feet become hard and tough and callous. You'll get a lot of corns and bunions. Fungal infections such as athlete's foot, that's usually found in between the toes, and nail infections, fungal nail infections become worse and more difficult to treat. You can also have diabetic ulcers as a result of previous injury and the slower wound healing. Your body will essentially break down and create ulcers on the feet that are very difficult to heal. You can also have ingrown toenails, and ingrown toenails can pierce the skin of the toes, and that can lead to infection and makes healing worse. Now, how do you know if you have a diabetic foot? There are several ways to find out. Now, let's go back to the nerve, the muscle, and the skin. If the nerve is damaged, essentially the doctor can perform a touch test or use a tuning fork on your feet to determine if you have any sensations in the feet. When it comes to the muscles, they will test the tendon reflexes to see how quickly you pull back from being exposed to certain stimuli, and they may also apply pressure. For the skin, we try to test if you're sweating. That's how we know if there's any protection there or if your skin is essentially working. We have a product that you can get in your pharmacy over the counter called neuropads. They stick to the bottom of your feet and they will change color depending on what activity is coming out or how much you're sweating. You can go to your pharmacy and ask for that product. It's called neuropads. And of course, nothing beats going to the doctor and getting your checkups and seeing the podiatrist to confirm that you have diabetic feet. Now, what happens when you are confirmed with having diabetic feet? You need to first of all control your diabetes. Nothing beats having controlled diabetes that delays the progression of the disease. It's more specific to the feet, you need to provide protection for the feet. So you need to wear proper socks, and there are special diabetic socks that exist that I'll talk about later on. You also need to wear proper shoes. They're not to be too tight and neither too loose, but especially not too tight. You're to always wear socks at home and always wear shoes, even if you're on the beach. I know in the news recently they're talking about people finding vials on the sand. You need to be able to protect your feet because if you're pricked with a needle and you don't feel it, that can lead to an infection. You're also to inspect your feet daily. If you have diabetic feet, you need to look for cuts and bruises along the foot bottom, top and bottom, from the knee going down. You need to check in between the toes if you have athlete's foot or if you see signs of a fungal infection coming on, because that means it requires urgent attention. Reshma spoke about pedicures and such, but you can still give yourself a little pedicure. Just be careful when you're doing it. We prefer if you use a file rather than scissors or a nail clip to cut the nail or to make the nail shorter. And you are to cut straight across. Do not make any curved edges. That reduces the likelihood of you getting an ingrown toenail. You are to dry the feet properly after a lukewarm bath, and you are to have your baths daily. I'll just put that out there. And the water temperature, again, cannot be too extreme. So not too hot, not too cold. Lukewarm, which is the perfect temperature for a newborn baby. So you dry your feet properly, especially in between the toes, again, to reduce the likelihood of infection. You do not want your feet to be too dry, though, so we still recommend that you moisturize with a lotion, but not in between the toes. Remove corns and calluses gently, and if you're unable to do it, then you go to a podiatrist every 2 to 3 months to have your feet inspected, and if you have any corns and calluses, then they can remove it for you. Now, speaking about the diabetic socks that I spoke about earlier, these are special socks. It's not just any socks that you can buy in the store. They're specifically sold in pharmacies and at the doctor's offices. They're essentially seamless, so there's nothing digging into your skin. The material is softer than usual socks, so it's not causing any abrasion against the skin. They're not tight, and they're sometimes padded, or should have extra padding, and the bottom is usually white. The sole of the sock is usually white, just in case there's any bleeding that you may not feel from an injury, you'll be able to see it. And they're highly absorbent. Now that concludes my brief mini talk on diabetic foot care. I hope it was beneficial to you in some way. Thank you.
Thank you very much, Jamila, for that presentation. And you know me, as almost everybody will know, I will have a question to ask, right? I'm just curious, is there any specific footwear that diabetes patients need to wear to ensure that they don't have any complications?
Yes, there are special diabetic shoes that exist, again, that are not tight-fitting. They're generally looser than normal shoes. They also have the extra padding that's also found in the socks, and they have extra features to allow the foot to breathe just the same in case there's excess sweating. So yes, there are diabetic shoes, and that can be found in certain shoe stores, and you can ask your pharmacy to direct you, or any diabetes resource clinician to direct you to where you can get some.
Okay, thank you very much, Jamila. Let's give Jamila a round of applause for her presentation. For those of you watching us on Facebook and YouTube, you still have time to come down to the Lions Center for the health fair. It's free to the public. We have free diabetes testing, PSA testing for prostate cancer, and site testing. We also have free diabetes consultation and nutrition consultation. We're going to take a quick break, and then we'll come back with our next presentation, which will be our medical presentation by Dr. Chestnut. So I'm sure you will not want to miss that presentation. Thanks for staying with us. We'll see you shortly.